Good evening, everybody. My name is Hannah Susag Bryant, and I'm going to be talking about health and illness among the military personnel and their families for the Cultural Practices Project. For this project specifically, I'm going to be talking about the United States Army, just because I have a lot of familial relation with the U.S. Army, being that my dad is in the Army still to this day, and I am actually married to a man in the Army as well. So I'm just going to start off with the key historical background points for that. The United States military was actually officially created on September 29th, 1789. The idea of having the U.S. military was proposed by General George Washington. Um, Although it was an important matter for him, it was not the most important thing for the Congress, apparently, because it took several reminders by George Washington before the bill was eventually passed that actually established the armed forces of the United States of America. Um, but once the bill was actually passed, the United States Army was the first military branch created, and over time, the United States Navy, Marines, and Air Force were established as well. What is health and what is illness? I wanted to talk about this in a little bit more in depth because when you ask a person what health and illness is to them, it can be something completely different than what it is to you. So I thought it would be important to have a couple different definitions on the two words. For instance, this definition of health is that it is a state of complete physical, mental, and social well-being and not merely the absence of disease, whereas illness is a condition of being unhealthy in your body or mind, or a specific condition that prevents your body or mind from working normally, or even as simple as being a sickness or disease. Whereas our textbook that we've been using all semester defines health as being the balance of the person, both within one's being physically, mentally, and spiritually, and in the outside world, natural, communal, and metaphysical. So it's not just talking about the person itself, but it's also talking about the environment and the energies that the person is exposed to. It also explains illness as an imbalance of the person both within one's being, physical, mental, and spiritual, but also on the outside world as well, meaning natural, communal, and metaphysical. Because I have so much relation with the Army, I actually had the privilege of interviewing several different people. My dad, my husband, and one of my friends, Danielle. I thought it was a good idea to do this because it kind of got three different perspectives of the same topic. So my dad has been in the military for a long time, ever since I can remember, and he defines health and illness as being health as being a person's well-being, whether that be physically, mentally, or emotionally, and illness being the general feeling of being unwell, either physically, mentally, or emotionally. So he's more thinking more so about the actual person itself, not so much everything that goes into it. He did not think that being in the Army or being in the service has changed the meanings of health or illness for him. And when asked about any circumstances or concerns that he's been faced with personally from being in the Army or specific risks, he said there are definite combat health risks. For instance, you're exposed to so much more because of your living circumstances where you are deployed. You have to take extra precautions to maintain health. Basic stuff like bathing, brushing your teeth, or even washing your hands is taken for granted because being in the field is definitely not clean. He even went as far as saying that when he's out in the field, it's more so like he's just passing out. He's not even really sleeping, so that affects him as well. But he does not believe that there are any beliefs, values, or behavior in the Army that has affected his health positively or negatively as far as daily life. But PT, which is their physical training that they do every morning around 5 a.m., is the one thing that affects all aspects of health because it is strenuous activity. It's challenging, both mentally, physically, everything. So it kind of pushes you, and it's a good way for people to relieve stress as well. Whereas my husband had more of a whole body experience as far as health and wellness go, because he defined health as being a status of your personal well-being, whether it be physical, mental, or even spiritual. An illness as a deficiency in your health status. He believed that being in the Army has changed his meaning of health and illness. For instance, now he believes that if you can walk, talk, and breathe, you are good to go. Whereas before he went in, meaning enlisted, he was concerned with every minute aspect of health. When asked for any concerns or circumstances he's been faced with personally, if he's noticed any health risks that were specific to the Army, he said living on post is definitely more oppressive mentally. Living off post, you get to de-stress from the day and your job, but you also get to be your own person. Whereas if you live on post, you don't really get to get out of that soldier mode. You're always kind of on the job. Whereas if you're off post, you get to leave work behind at the end of the day. But obvious health risks are when you're being deployed and in a combat zone. And then as far as any beliefs, values, or behavior that the Army has affected both positively or negatively, he said after being in the Army for 5 years, your body just feels worn and physically distressed, but it is also mentally draining. Whereas Danielle, she had a little different perspective because she's obviously a woman, so things are a little different for her. But she said she defines health as being free of illness physically, mentally, and emotionally. She defines illness as a sickness affecting you either physically, mentally, or emotionally as well. She said that the Army has definitely changed these meanings because at first when she enlisted she was young, and so therefore she only thought there was sickness or health. If she saw a fit person, she just assumed they were healthy and did not realize that they could be suffering mentally. As far as any concerns specific to her, any health risks related to the Army, she said since she's been in the Army, she has only suffered one major physical injury when she broke her wrist. But when she arrived to her first unit, she suffered anxiety attacks every day for 2 weeks, so it was definitely really hard for her to adjust mentally. But she also enjoys the freedom of being able to live off post. She definitely said it is less stressful for her. She said positive aspects about the on health as far as the Army comes. When you join the Army, you leave your family behind, so you have to make your own family, which she thought was kind of cool because you do become a family. And PT is hard, but it has definitely helped her physically, and she feels better because of it. TRICARE is one of the healthcare options, the main healthcare options that we have available to military personnel and their family. It provides patients with medical and dental care, and provides treatment to patients in a military treatment facility, and provides a list of physicians that are preferred in-network providers so you always know who to go to. TRICARE specifically is a regionally managed healthcare program for active duty and retired members of the uniformed services, their families, and survivors. TRICARE offers comprehensive, affordable health coverage with several health plan options, a robust pharmacy benefit, and dental options, and other special programs. Health concerns and circumstances, as well as social cultural factors. Military personnel are subjected to different health issues than average civilians. For instance, in combat zones, they have shrapnel, gunshot wounds, lost limbs, head and brain injuries, death, environmental hazards, contaminated waters, chemical infections, but even also mental problems like anxiety, post-traumatic stress disorder, depression, substance abuse, and suicide. When actually looking all these risks up, I found this article that was looking for the amount of veterans after partaking in the Iraqi and Afghanistan war between the years of 2008, how many of them actually ended up with some sort of mental diagnosis. They did this by looking at the national VA data online to see what was posted on there between the years 2002 and 2008. What they found was that around 40% of veterans in the program received mental health diagnoses. Around 22% were diagnosed with post-traumatic stress disorder specifically, and another 17% were diagnosed with depression. But another thing that was interesting was that over the couple years that they looked at, over a 2-year span, the rate of PTSD increased from 4 to 7 times after the invasion of Iraq. And active duty veterans under the age of 25 were had a higher rate of PTSD and alcohol and drug use compared to veterans older than 40. And women were actually at a higher risk for depression, but men were more likely to self-medicate through drugs and alcohol, which that was very interesting to me. Conclusions that they came up with were the amount of mental health diagnoses increased substantially after the start of the Iraq War among specific subgroups or vets in the VA healthcare system. My hypothetical character's name is Frank. He recently made the decision to enlist in the United States Army to better provide for his family. He did so because he was told that him and his family would be provided with free housing, and also provided with health insurance through TRICARE that will cover traditional health insurance and dental insurance with minimal copays, prescriptions, and little to no out-of-pocket costs. The deal seemed too good to be true for him, especially because his kids could go to elementary school, middle school, high school, and even junior college right there on base, which was Fort Hood. After graduating his Officer Candidate School, OCS, Frank Cleft was awarded the rank of second lieutenant. As a result of this, his family had decent housing benefits right away on Fort Hood. However, it was not long after his graduation that he received orders to deploy to Afghanistan. Unfortunately, Frank was injured during his tour. While out on patrol, a man in his unit set off an IED, and Frank was blown against a wall, knocked out, and suffered an injury to his left shoulder, which led to substantial blood loss from a lacerated wound. Frank was then medevaced away to receive proper medical care. And then this is where the cultural awareness and understanding in the medical profession is really important. Because upon arriving at the base, Frank was screened by medical personnel for injuries sustained from the blast. Luckily, Frank always wore his Jehovah's Witness identification bracelet. So as a result of him wearing this bracelet and the doctors knowing to look for stuff like this, the doctors knew not to give him any form of blood transfusions during his treatment. Instead, pressure was applied to the wound to stop the bleeding, and then it was stitched and bandaged properly to keep the wound clean. When Frank regained consciousness, he was able to tell the doctors how he wanted to proceed with his treatment. So by knowing to do that, they didn't offend him in any way in any sort of medical practice. And behaviors and beliefs as far as the Army goes, just talking from having conversations with my husband and my dad, basic training is very important, which is AKA boot camp. It seems really intense and really training on the men and women, but it is super important. For instance, I have listed hostility, strict rules, and discipline. That's really important so they know how to act under pressure. They know how to react in a combat position if that were to ever happen. Some men and women go through their entire Army military careers without being deployed, but some do get deployed. For instance, my husband has been through 2 deployments to Afghanistan, and my father has been deployed to Iraq twice so far, and then more beforehand. But all the yelling and the strenuous activity, all the mentally and physically restraining and challenging things that they do are completely necessary to make sure that they know how to react, how to think in high pressure, high risk situations. PT is very important to keep them in shape so they can stay in shape, obviously, if they were ever to be deployed, and their lack of sleep is also important so they know that they can still function properly and make conscious, effective decisions when they actually have to go into a combat field. So all of this is really important. So that's just some of the things specific to the Army. A lot of this also has to do with other military branches as well, like the Marines and the Air Force and everything like that. But this was specifically the Army because that is what I have the most relation to. So thank you for taking the time to watch my presentation, and I look forward to hearing any feedback and responses. Thank you.